So a common question I get in the comments whenever I talk about a zero depth procedure is sensation. How is sexual function going to be after this procedure, what to expect? And so in this video, we're going to get into it. So one thing that can surprise people about modern bottom surgery techniques and gender affirming surgery techniques is sexual function, once everything is healed, tends to be very good. And there are a few studies done on this, and indeed in some folks it can even be better than before surgery, because of course the brain is a really important part of the sexual experience, and if the patient feels better about their anatomy, they're going to be able to relax and enjoy it more. So one of the main focus when we do zero depth surgery is to preserve the nerves down there. So first of all, what do I mean by a zero depth procedure? It's also called vulvoplasty. There's lots of different terms for it, but it basically means that we're feminizing the anatomy. However, we're doing everything, but we're leaving out the canal. So we're not putting the canal in there. We do this for patients who don't want or need the vaginal canal. Some of the advantages of this is they don't have to dilate after surgery, so the recovery is a lot easier, and there are less potential complications with this. So usually patients choose this for personal reasons. I've commented on other videos that I'm seeing more and more folks choose this particular technique, especially later in life, for example, or if they don't plan on using the vagina for sex. Well, why go through this and go through all the care of looking after it and dilating after surgery? So when we put the anatomy back together, basically the head of the penis, in most cases, and we can customize it depending on the patient's preferences, but usually the head of the penis is going to make the clitoris. And I like to preserve any foreskin that's there, or as much tissue as possible from the tip of the penis and the connected nerves there. And those are going to be the clitoris. And for the vast majority of patients, that's where most of their erogenous sensation will come from. Now, depending on their sexual preferences, they are of course able to resume anal sex after surgery if that's important for their sex life, which many girls report that it is. And in this way, we're not getting rid of any of the nerves down below, so your sexual function and pleasure after surgery should be as good as vaginoplasty would be as well. Now, there is, of course, going to be a recovery phase, and this can be frustratingly long for some patients because when you're swollen down there, you're bruised, obviously things aren't going to feel too good. So it varies a lot how soon a patient will have an orgasm again after bottom surgery. I've seen anything from 3 days, which is very unusual, to several months after surgery, as the patient gets used to the new anatomy, as the swelling goes down. And it's usually part of your homework during recovery to relearn what feels good down there, but safe in the knowledge that the nerves are preserved. Because recovery is a little bit faster with zero depth, because you're not having to do dilation, there's less discharge after surgery, and we don't have to do douching and all that sort of thing. I do notice that patients who do zero depth, their sexual function returns a little bit sooner than vaginoplasty patients in most cases. Only the patient knows what is the right decision for her, whether she has to do the full vaginoplasty or the zero depth. I've been making more zero depth videos because a lot of patients aren't even aware that this is going to be an option for them. I posted one a few weeks ago and I could see in the comments many patients realizing for the first time that this was on the table, having already gone through a vaginoplasty. So just trying to get as much awareness as possible out there. I'm located here in Miami, Florida. I'm accepting consults for bottom surgery, and just go to the link in the bio if you're interested. We have patients who come from all over the world here to get their procedure, and we can start with a virtual consult. So hopefully this video answers a lot of you guys' questions about sensation and zero depth.